Now, 13 away from 9, this is a very worrying story. Cable theft is now not only threatening livelihoods, it's literally threatening lives. Patients at the Cecilia Makiwane hospital in the Eastern Cape have had to be moved to other facilities. This after cable theft had disrupted operations at the facility. Ronald Masinda is on the ground for us. Ronald, good morning. What have you found out so far?
Good morning, Gareth. Well, we are about to assess some of the damages at this particular hospital, Cecilia Makiwane, but we were told that the hospital was plunged into chaos on Tuesday as the cable thieves made their way inside the hospital, stealing lots and lots of cables. But for now, let's speak to the MEC spokesperson of health here in the province. Thank you, MK, for your time. First of all, describe the extent of the damages.
Thank you, Ronald. We can confirm that on Tuesday there was indeed a break-in whereby criminals cut through the fence and managed to get into the hospital, and they managed to steal a lot of electrical cables. This obviously resulted in a disruption of services that resulted in the hospital not being able to operate functionally. But through the capable leadership of the CEO, we managed to save the situation and operated using generators while he had to move some critical patients to the nearby Frey hospital. So the situation has been fully under control, and as you can see, the operations are fully back to normal now.
Driving into the hospital, you can clearly see that there are security guards. How did this then happen?
Unfortunately, with the security guards, as you did say that there are security guards, unfortunately they cannot be able to cover each and every inch of the hospital at the same time, which is how they managed to get through the other side of the hospital. We are beefing up security throughout the province, because this is not just a situation that only happens here at Cecilia Makiwane Hospital, because we've been experiencing a lot of cable theft at some of our facilities. Case in point, in Mandela Bay, there've been reported cases of cable theft. Also at the TP hospital in Port Alfred, we are currently operating. We're using a generator after thugs once again broke in and stole cable theft there. But the situation is fully under control. As I said, that we are installing CCTV cameras. We are also installing beams, and also ensuring that we beef up the manpower by adding more security guards.
Were there any lives under threat? And I'm sure this must have come as shocking news to many patients here.
Definitely, it came as a shocking news, but as I did say earlier on, there were no lives that were under threat as we moved all the critical patients to the nearby Frey hospital while continued using generators to ensure that our ICU for pediatric unit and the ICU for adults was fully operational. And I do want to say that there's been a breakthrough after 2 people alleged to be behind the stealing of the cables were arrested by the local community forum. They were since sent over to the police late last night, which was on Thursday. So we welcome that swift action from the community policing forum and the police.
Okay, so that's good news, some arrests made. How do you then assure that this doesn't happen again? You talk about beefing up security, but are there any other measures?
Other than the measures that we're beefing up, as I mentioned earlier on, we are also calling on communities to take full ownership of the government properties and also protecting our community healthcare workers, because they've also been targeted at some of the facilities. They've also been robbed at gunpoint, like it was the case just a couple of weeks at Godblessing Clinic in Mandela Bay. So we're really calling on communities to ensure that they protect the facilities, because at the end of the day, it will be them that will suffer when facilities like Cecilia Makiwane Hospital and other facilities are not able to properly offer the services that we do offer to our people.
We understand that there was a contractor here on site. Do we know how much this will cost?
Unfortunately, not at the moment, but we are happy that the contractor was appointed using emergency measures. As a result, everything is back to normal at the facility.
Last question. We know that this hospital has been around for many decades. I mean, Dansani on its own is one of the biggest townships in South Africa. Have we had these instances or incidents before?
Not to this length, but every now and then you do get criminal elements which we are working very hard, working with the community, working with the security cluster to ensure that we root them out, which then goes back to the call that we're making to ensure that communities take full ownership of the properties of government and also protect the healthcare workers.
All right. Thank you so much for your time. We really appreciate it, MK Damase. And we will be, during the next hour, entering the hospital just to see how damaged those areas that have been affected. But what we also have heard during our time here is that this has affected many patients, even patients who were supposed to be giving birth here had to be diverted to other hospitals. There were also concerns about the corpses that lied in the fridges here, that they also could be damaged. But as we heard from Damase, it seems like there were contingency plans put in place so that to avoid any chaos. But it's back to you for now.